Thank you, Dr. Chai, for taking the time and answering some of my questions. I was wondering if you could give a background on your past educational experiences and all that good stuff.
Sure. My name is Dr. Raven Chai. I'm an emergency physician for the Baptist Health System. Trained at SUNY Downstate Medical School, in my residency in New Jersey, ER residency. I've always had an interest in international health. Did a lot of global work in Asia, India, and Brazil. So that's a little bit about me.
Okay, well that's great. I am actually a psychology student. I'm interested in viewing the patient as a whole and kind of studying the importance of considering mental health when evaluating a patient for physical ailments. A study conducted by the American College of Emergency Physicians found over 80% of emergency physicians in the U.S. believe that mental health systems currently in place in their communities and surrounding regions are not providing optimal care for their patients. These statistics are troubling due to the data found by the Agency for Healthcare Research and Quality, which reported that mental health and substance abuse cases accounted for 1 in 8 emergency room visits in the United States in 2010. Do you believe there's a deficiency in the quality of care provided to those suffering from mental illness in the emergency room that you work here in the United States or in other areas in the United States? If so, how do you feel we can approach this issue?
It is dependent on the hospital. It is dependent on the healthcare system. It is dependent on the culture. It is dependent on a variety of factors.
Mm-hmm.
I was trained for medical school in Brooklyn, and one of the hospitals had a dedicated ER emergency room. So all psychiatric emergencies, all psychiatric patients brought in by ambulance or anybody arrived to the ER with psychiatric concerns would be seen at that hospital. At the psychiatric ER. So I thought that was very, very, very effective. It was called Cfde. The acronym for which it stands for escapes me, but it is very dependent on the hospital. Now, we are all trained as healthcare providers to recognize certain basic psychiatric features. For example, suicidal, homicidal ideation, and so regarding that, there are systems in place where psychiatric emergencies are recognized and help is provided. Now, there are certain hospitals with psychiatrists on call, and there are certain hospitals that don't have psychiatrists on call. But there are always systems in place to provide help for those patients. Now, in terms of adequacy, again, it depends on the hospital, and it depends on the healthcare system. So, for example, when I was working in China, there was also a dedicated ER for psychiatric patients as well.
Okay.
So again, it's culturally dependent.
Okay.
So psychiatry is always, is always a real tricky field. You could always benefit from more help. Always, whether from medicine or psychiatry or in all aspects. We can always improve. There's always areas for improvement.
Okay. And for areas of improvement, how could someone or an institution...
Education, always educating staff to recognize certain psychiatric symptoms and so forth.
So my second question is, patients with schizophrenia, depression, and other mood disorders constitute the highest rate of emergency department visits among those with chronic conditions. Yet, with no universal protocol in the U.S. For the evaluation and treatment of patients who present with psychiatric emergencies, this is a little troubling. So, is there a protocol in place at the institution you work at? And if so,
yes, there is. Basically, there is a. So it depends. Some facilities, some ERs, they have psychiatrists on call who can come and directly evaluate the patient and determine placement and admission of the patient, if they need to be admitted or they can be cleared from the emergency room. There are other, hospitals that have social work that will arrange placement for psychiatric evaluation. So there are systems in place to deal with psychiatric emergencies such as schizophrenia or any suicidal or homicidal tendencies.
Okay, and so you believe this protocol is successful in treating these patients, so you don't feel, because I know that in another poll we saw that only 17% of emergency facilities reported having a psychiatrist on call to the response.
Yes, so the current facility I work at, to the best of my knowledge, in one of the hospitals that I work at, they do not have that in place, but there are systems in place to make sure that the patient gets the help they need in terms of arranging placement of the patient for psychiatric evaluation, even though we do not have a psychiatrist on call 24 hours a day.
Okay. All right. And so is everyone kind of trained for that?
Is everyone kind of trained?
Yeah. Like for mental, let's say a mental psychiatric emergency. So someone has suicidal ideation.
Yes, we are. Yes, all ER physicians are trained to deal with crises like suicidal, homicidal ideation.
Okay, and what about kind of assistants like nurses, PAs? Are they also trained for that?
I would assume they would have some sort of training. So in terms of my team, they function very fluid. They function very well together. So they are very good at notifying the ED physician if there are any psychiatric concerns, for example, suicidal homicidal or inability to care for themselves.
Okay. All right. And so. Having experienced India yourself, being a country that lacks resources, have you experienced India's healthcare system? Just asking.
Have I experienced? I'm so sorry. Can you repeat the last one?
Yeah. Have you ever? Because you mentioned you've done work globally. Have you experienced India's health system?
Yes, I have actually. So in China, for example, they have also dedicated, well, depending on the facility, obviously, but they do have a dedicated psychiatric facility for psychiatric emergencies, which I feel they handle fairly well. So I feel like it really depends. It's really hospital-based as opposed to country-based. There are many varieties in terms of the hospital systems within a certain country, within a certain region, within a certain city, within a certain hospital corporation, and just like that, in different countries it varies as well.
Okay, and so have you worked at a hospital? This is like off like whatever. I was just wondering if you worked at a hospital in India. Did you ever do that?
I have worked in a hospital in India. I've worked in hospitals in Brazil. I've worked in hospitals in Asia as well.
Oh, okay. Okay, and so you notice that the country lacks resources, and
oh, absolutely.
And so, what possible solution do you think might bridge that gap of responding to psychiatric emergencies? Because we do have that
Yeah, so that, it really comes down to the basics, education. Education. People need to be educated. Healthcare professionals need to be educated to recognize certain psychiatric illnesses. Now, when I worked in China, when I was doing research there in the hospitals, they handle it fairly well. They have a really good system in place, very solid system in place, to deal with this. There are certain other areas that I've worked at. They are not as knowledgeable in how to handle these cases, So, I wouldn't say it's country dependent. I would say it's more hospital dependent.
Okay. So, last question. According to the World Health Organization, 13.7% of Indians are mentally ill compared to 18.5% in the U.S. As an emergency physician, what are common risk factors leading to developing a mental illness in the U.S. that you've seen or experienced?
Absolutely, it's stress. It's culturally dependent, and it's also stress. Mental illness needs to be taken on a contextual basis. It's cultural. Mental illness is cultural. Mm-hmm. Every culture has. There are certain diseases that exist in certain cultures that are absent in other cultures. Mm-hmm. And in the United States, there is a certain, there are certain factors that contribute to certain mental illnesses. For example, the stress, the pressure in our workforce is different from other countries. Not to say it's more or less, but it's different, and that can contribute to higher rates of certain mental illnesses.
Okay. And so, living in India and being and working in India, why do you believe that this difference in prevalence exists between India?
It's a social cultural. The reason it's social cultural. It depends on the culture. It depends on cultural beliefs and the cultural function, the functionings of the society and the belief systems. Mm-hmm. India has a very, they have a very traditional values. They have very traditional values, and I wouldn't say they're more or less religious, but their spiritual practices are very different from those of the West. Mm-hmm. That's one aspect. Whether that is an answer or not to why they have lesser prevalence of mental illness needs to be further examined. I don't have the answer to that. But what's very interesting is that also you have to take into context how that report was gathered, because Asian cultures and including Indians, there's a certain stigma to mental illness. So it could be just that they're just less reported.
Exactly.
So that could account for the difference.
Stigma. You mentioned stigma. I'd love to hear maybe your experience with stigma here in the U.S. and compared to your experience with stigma in other countries.
Well, here's the situation. In the United States, you have these CEOs. Professionals. Certain professionals that it's normal to see a psychiatrist. They have psychiatrists in the workforce because of the stress in the workforce. It's more widely accepted. It's the stigma. I would say it's relatively, depending on certain factors, a little less compared to certain other societies where you are ostracized from society for having a mental illness. I would say that in the United States, relatively, depending on perspective, it can be seen as more widely accepted. Mm-hmm. So, you have these high performing or individuals in high stress jobs. They have psychiatrists in the workforce that are available to them. That it's normal. It's kind of accepted that you're seeing a psychiatrist if you have high stress. Mm-hmm. But in other countries, having a mental illness, it's a stigma that that can ostracize you from your family or society. So it's very different. It's very, very different.
So do you have any kind of specific experiences you'd like to share with, if you have ever experienced stigma kind of?
Well, here's the thing. It is very interesting because, even though that kind of stigma it's a well-known, it's a well-known cultural phenomenon, cultural difference. When I was working in China, in the mental health facility specifically, their care was very impressive. So, for example, schizophrenia, it's all over the world, and what's very interesting is how it's treated. So, when I was in China, the hospital I was working at had a dedicated psychiatric facility, and these psychiatric patients, we're treated with a combination of Eastern and Western medicine, traditional Chinese medicine and Western pharmaceuticals.
Mm-hmm.
So it's very different. But, so it depends again, if you go to the villages, I'm sure they'll have a very different acceptance or, treatment for patients with mental illness. They may not even recognize it because of lack of education, which is based on basic the basic social systems.
And did you, this is just out of curiosity, did you notice that in Eastern countries, where you've worked at, China, India, that they would kind of see the person as holistically, right? So consider different types of factors that may be affecting, leading to symptoms, right?
Yes, of course. There's a combination again. So there's obviously neuropsychiatric profile, regarding hormones and chemical imbalances. But by and large, they accept that. Well, this is strictly based on the hospital I worked at. They had a fairly good understanding of mental illness, but they added an additional layer of their own health system, which is traditional Chinese medicine. This is specific to China and certain Asian countries.
And so, okay, so they had a fairly good understanding of mental illness and just everything. Having experienced that that type of environment and that approach to physical ailments, how did you take that to like the U.S.? Do you kind of implement that in your care?
Healthcare in general, despite the basis of medicine, despite the physiological, understanding and basis for medicine and medical therapy, there's a cultural context to illness that needs to be kept in mind.
Mm-hmm. Yeah.
The physician, the healthcare provider needs to be mindful of the cultural context to all illnesses, especially in the United States, because when there's so much diversity, you have to take into the context the person's cultural beliefs.
Of course.
Where the person is, with the belief system of that individual.
Mm-hmm.
And that made me more mindful of that.
Of course. Okay. Well, thank you so much, Dr. Chai, for taking the time to meet with me over the phone.
It's my pleasure.
It's been a great conversation.
Absolutely.